My name is Sereh Sanneh. I'm an RN BSN working at Edward Francis Small Teaching Hospital. I was recommended by the First Lady of the Republic of the Gambia to undergo this training in Merck Foundation program. When you look at the Gambia, one of the problems when it comes to the healthcare system will be to have the specialized trained nurses or doctors that will care for the patient that will need that specialty attention. So first thing will have to be with the shortage of specialties in our country. You realize that patients that are in the rural areas, they find it very difficult to have that specialized treatment that is needed because there is no sufficient doctors or nurses to care for them that will need that specialty attention. So I believe specialty care is very important in every country, especially in the Gambia. The two things that I feel specialty care will have an impact on our country will be for them to have career development in nurses or doctors that are going to be involved in that specialty, and to bring out policies to retain them, people that have undergone that training, so that they'll be able to practice in that country for the people that will need their services. The second one will be infrastructural development. Yes, to train people to know how to take care of patients that will need the specialty care is important, but we need to have facilities to render the services to them. Is it the equipment that we will need to care for that patient? Is it the hospitals that are fully equipped so that patients or individuals, the doctors and nurses can take care of those patients? So it is important to empower people, to train them. It's also important to build hospitals to provide equipment to render those services to them, so that the things that we will learn, we'll be able to implement it in those hospitals. I believe Merck Foundation training is very important for me, for the patient that will be needing the care, and also for the Gambian people at large. The first thing will be, when it comes to me, it will help to build my career, as in the things that I've learned in this institution, I'll be able to practice it when I go back home. So secondly, when you look at the impact it will have on the patient, will be to improve the quality of care that I give to that patient. Due to this training, I'm confident enough to care for patients that are having critically ill conditions, and to be able to render that care for them and to the country at large. Through this training, it will help to empower and build our healthcare system through training of nurses and doctors in different specialties. So coming into these programs, my expectation is to enhance the knowledge in critical care, and also to be able to see how certain things are done in different countries. So far in the 3 months training that I've had here in this country, I met different specialties in different areas of intensive care. I'm able to see how certain disease conditions that we don't readily see in our country, how it is being treated. And I'm also able to interact with different doctors, different specialty nurses on how to care for certain patients. So my expectations coming to this program has been met, because I'm able to learn, observe, and practice some of the information that I've learned. Coming to this country, I work in the intensive care unit in the Gambia, and we only have one general intensive care unit. So coming to Krishna Hospital, I'm able to go to different intensive care units wherein I'm able to see how they take care of patients that are newly involved in road traffic accidents. When they come into the ER, the emergency responses that they do, I see firsthand how they do intubations. I see how they collect arterial blood pressure, gases, and how it is being interpreted to take care of patients that are on mechanical ventilator. I'm also able to go to the cardiology ICU, wherein we see the professional doctors on how they do certain operations like pacemaker. They did a pacemaker, open heart surgery on certain patients that we have seen. We also seen them doing angioplasty and angiography. So basically, more exposures that I've had here. I cannot list everything, But basically, these are the main things that I've seen and during my time that I've spent in the ICUs. I believe that the information, the education, the things that I've learned here will not also help me in my career development, but also the patient that will be needing the services in the intensive care unit. I'm able to fully assess, assist, and take care of patients that are having critically ill conditions. Though we don't have certain machines that, wherein I'm able to do some diagnosis tests or information that we have seen here, I may not be able to implement it back home, but I believe in the near future, when we have such machines, I'm already exposed to them, and I'll be able to do the needful when it comes to caring for that patient and doing necessary interpretations about their results or values pertaining to different tests that will be done. The advices that I will give to the new aspirant of nurses or doctors that are coming for such trainings will be for them to research about the foundation, or research about the area of interest they want to do, whether it aligns with the things that they're practicing back home. I'd also advise them to make applications and apply for the program, because it is not only beneficiary to yourself, but also you'll be able to learn and make an impact back home. So it's important. So, and also the cultural aspect too. One, you can easily Google or read about the Asian culture. It's quite different from what we are used to back home, but at the end of the day, the most important thing is the knowledge gain and the knowledge that you'll be able to impact when you go back home. So it's to the new aspirant that would want to apply for this Merck Foundation, it's a great deal, meaning you will learn a lot from the institution that you'll be posted to. You'll be exposed to so many things that you've not been seen in the country, and as a result, this will not only impact you, but also the patient. And if you have any questions, if you have any information regarding this training, you can as well link with your seniors and also make the necessary appointment or information that is needed so that you can be part of this training program. In conclusion, I would like to thank our First Lady for giving me this opportunity to come to India, to come to Krishna Hospital, one of the best hospitals in India, to enhance my skill, to be exposed to different things that I've not seen in the country, to be exposed to see how to manage patients that are having critically ill patients, to observe, treat, and do some techniques that are not done in our country. So I would like to thank the First Lady for giving me such opportunity. I also like to thank Merck Foundation for giving us this opportunity to enhance our skill, to making sure that we don't only learn or do things in our country, but to be exposed to how certain countries do their own thing. Specialty course or specialty area is very important and paramount in our country's development. So it is quite important, and I'm glad that Merck Foundation is helping the people of the Gambia in order to know their different specialties and how to take care of certain patients that will need it. I also would like to thank the people that I've worked with during this process. They have been really helpful about the information that we will need. They guide us through the way, and we are very much thankful for that. We also would like to thank the Krishna Hospital staffs, the head of school, our own coordinator, Mr. Prakas, for always being there, for providing us with the necessary things that we need. It has been a smooth ride, yes. We have some bumpy roads along the ride, but Alhamdulillah, we have successfully completed our training and will be forever grateful for the opportunities that Merck Foundation have given us. Thank you. The Gambia.